Hi, my name is Takhona, and I am a student at UNC studying health policy and management. There are two questions that policymakers and stakeholders may be interested in whenever new treatment is developed. First, and most importantly, is the new treatment effective? Secondly, is the new treatment a good use of our available resources? That is it cost effective? The first question regarding effectiveness is usually answered through clinical trials and other scientific methods of inquiry. The question of cost effectiveness can be informed by decision analysis. Decision analysis is a probabilistic method of simulating alternatives under uncertainty and exploring the trade-offs between costs and benefits. I am working with Dr. Jillian Sanders-Schmidtler to create a decision modeling framework that will compare the cost effectiveness of implantable cardiac devices in patients with heart failure, specifically looking at devices for cardiac resynchronization therapy, or CRT. These devices are essentially pacemakers or defibrillators that help the heart to pump blood more efficiently. Upwards of 6 million people in the US suffer from heart failure and may benefit from these innovative devices. But these devices are expensive and may not be appropriate for every patient. In addition, although there are several clinical trials exploring the effectiveness of CRT in various populations of interest, numerous clinical and policy questions remain unanswered. These challenges are some of the reasons why it is critical to perform decision analysis. We want to know exactly in which patients are CRT devices most effective, and when is such treatment also good use of our limited resources. The goal of the decision model is to illustrate the different costs and benefits of CRT, as well as simulate the disease progression of a hypothetical group of patients who receive these devices. What makes decision modeling innovative is that it combines all available data sources relevant to the research question. This includes data from clinical trials, patient registries, published findings, as well as clinical expertise. This rich pool of data allows us to answer questions like, do CRT outcomes differ based on patient race, ethnicity, or gender? Although the effectiveness and cost effectiveness of CRT has been studied before, this has usually been done in the context of a single clinical trial. Our analysis is much more expansive and holistic. All that said, traditional cost effectiveness models only tell us the costs and consequences of different treatment options. They don't tell us who gains and who loses in the real world. For example, spoiler alert, CRT devices have been found to be cost-effective in the literature, but Black and other patients of color are less likely to receive them. Cost-effectiveness analysis is important because it tells us how resources can be used more effectively, but we also need to consider how they can be used more equitably. Decision modeling is only one piece of the puzzle, but it is a good place to start in the move towards evidence-based decision-making. Thank you.